Hello and welcome back to Nolan Financial Radio. My name is Chris McKinney from Nolan Financial Partners. If you'd like more information about what you're here during today's show, please give us a call at 719-210-4242. You can also visit us out at our website, nolanfinancialpartners.com. And while at our website, click on the radio page. You can check out our past shows and subscribe to our program on Apple Podcasts or Spotify. Please do not hesitate to reach out to us with questions or set up a face-to-face or even a virtual meeting. So, like many other industries, technology is rapidly reshaping healthcare. Hospital at home programs are growing in popularity because they provide some people with a chance to receive at home and programs may also help medical facilities relieve recovery rooms for people more in need of care. Imagine you aren't feeling well and you aren't sure what's causing. Find back to the emergency room, which you soon discover is chaotically full of people needing various levels of care. Finally, after seeing a doctor, you're informed that your condition is manageable and you qualify to receive treatment and aftercare right in the comfort of your very own home. Sounds too good to be true. Thanks to the increasing use of hospital at-home programs, it's quickly becoming a reality. During today's episode, we're going to look at hospital at-home programs and what benefits they may provide retirees and older Americans. Later in the show, we'll also discuss ins and outs of long-term care insurance. But before we get into our topics, let me introduce you to my co-host, Tony Shore, who is embracing the warmer weather by wearing flip-flops in the studio today.
No, I'm not. He's kidding. Hey, you have a great theme song to your show when both hosts are bopping along to it as it plays, right?
Oh yeah.
We were both jamming on the today's theme music that we used.
It's good. It's good.
Catchy.
I like that. I like music. I like to have music on when I'm doing things I don't like to do because it makes me feel better.
Yes, me too. Same. And of course, I love music.
Yes.
You can see the albums behind me for those watching on the YouTube video. I have a lot of records and I love to listen to music. So, but yeah, this is an interesting topic you've picked for us today, Chris. It's going to be interesting. Hospital at home. Wasn't aware of this program or that people were doing this, but anxious to dig into it. Now, first, I have to ask you how you've been. I know Tara is she over in Germany now or gallivanting around the country again?
She is over in Germany where she's working, and then they send her for work to Washington, D.C. So she's been going back and forth
Wow.
from Germany to D.C. And then I think she's coming to Colorado soon, and then she's going back to Germany. She's going to be in Germany all summer.
Wow. Well, yeah. I know you're holding down the fort, meeting with clients, talking to prospects. You love to hear from the listeners on topics they want to hear about on the show, or if they want to get a financial plan in place for retirement. I always encourage our listeners out there to pick up the phone, give you a call, because Chris, you have to have a financial plan in place, and you have to have healthcare figured into that. Are you going to have healthcare in retirement? Are you retiring before you're eligible for Medicare? Or, will you need Medicare supplements or Advantage plans? And how much do you need to budget for healthcare? So I know all this comes into play. But today we're talking about kind of a unique thing in this. It's that hospital at home program you mentioned. I'm anxious to hear what you have to say.
So people have been doing this for a long time on their own, but now there's going to be some support from the hospitals and from caregivers, right?
Sure.
So hospital home, it's a specific designation. So for those patients who require hospital level services, but who are also viewed as stable enough to receive the care at home.
Sure.
So this really helps people that want to stay at home. They want to stay in the comfort of their own bed and their own environments and with their own, favorites on their TV. They know how to use it and just be at home. And I think this is a great idea. It's going to save people so much money versus being in a hospital. Um, and but they're going to be, I think it's going to be better care, to be honest. If they're at home and they're in their own environments, they're going to feel better, right? I lost you, Tony. You're muted.
What? I'm sorry about that. Who wants to stay 2 weeks in a hospital, right? Or even overnight at a hospital? You'd rather stay at your
Yeah,
own home, right? And as long as you
yeah.
can get the care you need, I think that's the key right there. And I know some hospitals are now offering this. So, is it more about patient care or is it more about the cost?
I think to me, it's more about patient care. Um, but if you can do that treatment right on your living room couch, it's clear no matter how widely adopted hospital at home programs come, there will always be limitations.
Sure.
You're not going to have to. You're still going to need ICU care and surgery. You have to be in the
Yes.
hospital for that stuff,
Yeah.
but it is going to save you a lot of money because being in that hospital, you use all those little hospital items, right?
Hmm.
And then the nursing care and all that stuff adds up to your bill. So the reading I've done about it shows that it's going to be less expensive for people.
Yeah. Yeah, it should be. I mean, it just depends on the hospital and how they bill or what they have to bill to send people out to your home. But when my dad was in the hospital, I was looking over the bill after he got it,
Oh, yeah.
and um, the styrofoam cup with a lid and a straw that they gave him to use. I forget. I think just the cup and the straw and the lid was a
Oh, yeah.
$15. It's like,
Right.
which you could do, it's worth about a nickel. So a
Yeah.
styrofoam cup
Yeah.
is that's insanity, right?
They bring you a new one.
Yes, and then they bill you for it.
And then they bill
Yeah.
you for it. Yeah.
So, yeah, that makes sense, and I could see how the costs would change, and I think that's true.
Well, and a lot of people that, study what happens in hospitals, the
Hmm.
health advocates, they're concerned about hospital-acquired infections and less
That's
restful
true.
sleep, those kind of things, that happen in hospitals. So, I think it's clear that the research has shown that, there's a lot of health benefits for being at home versus being in the hospital. Now, if you have an emergent situation, that's a different thing. But being at home, I think a lot of care is going to be good.
Yeah. Yeah, although I would imagine that this hospital at home program would be challenging in rural areas. I mean, it's a program that might require a lot of staff to do driving throughout the day as well. Would
That's
be
a
on the con side.
certainly good point, Tony. At a time when healthcare systems throughout the country are wrestling with a lot of health equity gaps in between rural and urban. The hospital at home programs outside of urban and suburban areas may prove to be a challenge, right? So I mean,
Right.
how they're not going to be able to do it. These small hospitals aren't going to have the kind of administration and staffing to do those kind of things. So um, now many rurals also lack the reliable broadband service that is needed for this because you gotta have, broadband, to have that, but, with
Yeah,
the COVID money, there's a lot of, good broadband going out into rural areas, so maybe that will change.
yeah. I know that's a problem where my parents live. That's a big problem. They don't have Wi-Fi out there that they have like a some kind of a DSL or whatever, and it barely works where they're at. It's
Right,
almost worthless. The data on my phone works much better than I don't even use it, and it's unusable if you want to stream something. I mean, it's really
right,
bad. So
right.
so that is a real concern. I'm glad you brought that up. Wi-Fi. to have access if doctors need to access things or nurses. That's a great point. That's something I wouldn't have thought. And you mentioned COVID. Do you
Right.
think this hospital at home program they started popping up more because of COVID shutdowns? Well,
Oh
people
yeah.
were utilizing telehealth and got used to, that.
Yeah, of course.
Yeah.
So many people, they want to work from home. They want to be sick from home. And
Yeah,
so
that's true.
a, a
Yeah.
lot of people really discovered they liked having that telehealth where they just call, hey, this is my problem. I need this help. Can you send out the help, whether it's just the medication or it's a person, and then they don't have to do the driving. They don't have to go sit in a waiting room for a long time. It's a lot less stress, especially if you're sick. If you don't have somebody to drive you because maybe your spouse has to work, it's a real pain sometimes getting access to care.
Yeah. Yeah, I imagine it is. I mean, that's tough. And so, yeah, I think people got used to telehealth. I mean, I know my family has
Yeah,
started utilizing that more when we need to see a doctor. They give me a choice. I can either go into the clinic or I can just do it via video conference or via video service like Skype
right.
or Teams or whatever it is. So,
Well, and
yeah,
I
I think
I can
that
usually get a
helps.
virtual call within a week, but takes me 3 weeks to get an appointment. So
Exactly. Yeah, they say if you want to do it virtually, you can see your doctor to talk to your doctor today.
yeah,
If you don't, it'll be 2 weeks. It's like, well, okay, I guess I'll do it virtually then. So, yeah. Yeah, right? I mean,
yeah,
that makes sense.
yeah. I think virtual healthcare is good. Um, we've got to get the doctors used to it too. Some of the doctors are not like, oh, I don't. They're not sure that's what they want to do, but
Yeah,
a
I
lot of
can
them
see that.
a lot of them are embracing it fully because
Yeah.
they don't actually want to see people.
Right. Yeah, that's true. So, before we move on, I
Yeah,
think what this lends to is the healthcare is a significant cost in retirement. As we get older, of course, we spend more
yes,
on healthcare. Medicare doesn't cover everything, but that needs to be part of an overall retirement income plan and financial
that's right.
plan. So, when it comes to our investments, our financial plan, and our retirement plans, I know that's what you can help our listeners with. How can they get a hold of you to set up that complimentary, no cost, no obligation consultation?
So, they can reach us at 719-210-4242. They can check us out at our website, nolanfinancialpartners.com. You can reach us, through that as well, just send us an email from the webpage there. Um, but we really, stress making sure that we have the right medical, uh, health insurance, the right medical plan, to go along with a good financial plan because they go hand in hand when you're in retirement and you're starting these healthcare issues are popping up for you. And if you don't have an idea of how you're going to pay for it, then it can be lead to a really rocky retirement, in your finances, right?
Yes. Yep, that's true. So that I'll tell you what, that's why it's so important to have a plan and a written
Yes.
plan, right? Not just I've got an IRA or a 401k, right?
Well, often when we go to retirement, we go in with somebody else, and so if we write it down, then we're all on the same page.
Yeah, yeah, there you go. Well, let's continue with this topic. I mean, I've learned a lot so far. I'm eager to hear, though, more about the hospital at home program. What else do you have for us?
So Medicare is kind of aided in the growth of another factor toward driving hospital to be at home. Specifically, Medicare reimbursement for hospital at home expenses is now at the same rate as inpatient care was during the COVID-19 public health emergency. So, initially, the Centers for Medicare and Medicaid Services, or CMS, created a waiver that allowed hospitals to provide acute inpatient care at a patient's home. So, through this, that even though the health emergency ended last month in May, the temporary waiver for the acute hospital care at home program was extended through the end of 2024.
Wow. Okay.
Yeah,
That's good. That's good news, right?
it is. So you can get that waiver for hospital at home programs. So it includes a bunch of systems, over 100 systems, and over 300 hospitals in 37 different states. So if you're eligible for that, then you can find out about that and take advantage of that. Some of the programs may not yet be active, and they're still working on them, but a lot of the bigger healthcare providers are going this route. They like it too because then they don't have to have real estate, right?
Yeah.
They can reduce their real estate cost.
Right.
Um, and then reduce their on-staff cost for a hospital for people that aren't, they're sitting there waiting for something to happen, right?
Yeah, and
Um,
these incentives are even on a personal level or for the
yeah,
hospital, that's a powerful motivating force, isn't it?
it is, and so, um, we all want things to be better for everybody, and that includes the people that take care of our health.
Oh, yeah, for sure. Yeah.
And so I can tell you that we've got a number of travel nurses that are clients, and they really like being travel nurses. They like going out and being at people's homes to help take care of them. So hopefully they'll get treated a little better than they have been. Some of them complain about some of the problems. I think the COVID emergency changed the dynamic for them a lot, and
Oh,
so I
yeah.
think they're in a better shape, actually.
Yeah. And I know not all hospitals have this hospital at home program, but I have to think that even large, sophisticated healthcare systems need to find, they probably will find launching a hospital at home program from the ground up kind of daunting. What about that?
Yeah, that's true, Tony. But it doesn't mean it's not worth it, right? So,
Right, right.
the one of the articles I read, they talked about a hospital in Olympia, Washington, and it launched its home program at the end of 2021. It took 6 months to receive approval. The the virtual care and the digital health, they noted that processes were extremely complex, and so they needed different technology. They needed additional staff, so that they could treat on-site patients, that because it was different with the hospital at home deal, right?
Yeah,
And so
hospital home patients are different than treating on-site patients, and so
yeah.
there's training involved,
So they
there's
yeah,
software involved, yeah.
yeah, so it's a process, and so if your local hospital is going to it, then it's worth finding out about it and see where they are on that. Um, and then the other part of this is, the staffing shortages are everywhere in professional organizations, and so that includes hospitals. And so I think the hospital at home program, um, you know, had that issue. So it maybe fits and starts getting going for that hospital. But I think because I think there's a lot of nurses that are going to like that type of care, that
Yeah.
that it will get going, and they will get it staffed,
Yes.
because I think it's just the way of the future as far as care goes. I mean,
Yeah.
how many procedures you've gone to and you thought you're gonna be staying the night and it's an outpatient, and all of a sudden
Oh,
you're at
yeah.
home, right?
I was
And
surprised. My son had his appendix, taken out. He had an appendicitis, and he had to be
right.
rushed in, and they said, "Oh, yeah, we're gonna operate on this right away." He was home that afternoon walking around after just a few hours. I mean, it
Yeah.
was that's insane. I mean, before you had an appendix removed, you'd be in the hospital a few days.
Well, that's the great thing about modern surgery, right? Is the tools have gotten smaller, the processes are much more well known by the doctors, And so they're not in there fumbling around. They go in there with a unique skill to get those things out, and then they close them up, and your body's like, hey, what happened? I think I have a little cut there, and it doesn't even have a big impact on you, where it used to be appendicitis was a 3 or 4 day stay.
Yeah. Yeah. Yeah, that's true. And I mean, that's a good point. Now, there have been a lot of news stories about healthcare staffing shortages, and
Yeah,
believe me, I know about those.
sure.
That's crazy. My wife deals with this. She's a recruiter for in the healthcare industry, so she's trying to find people to fill these jobs. And I've got to imagine that factor must be another challenge when a
Yeah.
hospital's trying to establish this hospital at home program, right?
Yeah, it is. They really got to approach it from. I mean, there's a lot of various things to deal with. One of them is also safety, right? And so there's you got to make sure that the health is being done correctly, that the patient safety is taken into account, and all those kind of things. And so there are some groups that are trying to support the hospital at home programs, but they're also ensuring that it's effective and it's safe. And so they're going to use technology to help do that by creating easy way for that information to get back and forth between the hospital and the patient. If you're on a pump or something, and there's going to be an alarm sounding at a hospital, right?
Yeah.
So
Yep.
somebody's going to hear it, and then things will get activated. Maybe they can have enough technology there to fix it from the hospital. So there's so many factors going into this that are still being worked out. I guess that's the main thing is if it's right for you, you want to know what the safety of that is, how effective is that home care, how close are you to emergent care if something goes badly, so that somebody can come pick you up and take you to the hospital. These are
Yeah.
a lot of considerations that go into this.
Sure. Sure. So, and then, I know that that's a concern, and long-term care is a concern, and people are looking at maybe having people stay at home for that as well, because long-term care insurance is outrageous. So,
It really is.
people are looking more and more toward in-home care for the elderly. Um,
Yeah.
I just, I think the issue with that has been the staffing, how to do it, how to pay
Yeah.
for it, and right?
That's right. And because so the US Department of Health and Human Services have determined that about 70% of all Americans who reach age 65 will need some type of long-term care during their retirements. Okay? That's 7
Wow.
out of 10. So if you're in a room with 10 people and you look around, you know, you're probably one of those 7. And so it's something that we want to help our clients plan for. We want to help all our listeners plan for it. Um, the um, we really need to get going on getting that long term care in place.
Yep. Yeah, we really should. And obviously, when we talk about this at home hospital at home program or long term care, um, it just seems to get complicated as we get older, and especially for people in retirement, which is sad because you want your loved ones, especially our seniors. And as I get older, I'm concerned about it for my parents. This has been an issue. My mom is at a nursing facility, an assisted living facility, because she needs full-time care. It would be great if she could have stayed at home and received that. That's my point.
Yeah, I agree with that. My mom is taking care of my dad. He's got dementia. senility. But she also has somebody that she runs a farm. She has people that comes and helps her clean the house. She has people that come and help her take care of the farm. That way she can be around for my father. And
Yeah.
but he's a lot more comfortable being there. And he doesn't have long-term care, so he's kind of stuck. Now my mom has long-term care because she kind of knew that she was probably going to live longer than he was. And her mother needed long-term care. So she got it way back in the day when it was cheap.
Right? There
Yeah.
you go. Yeah, it's not so cheap anymore.
It's not so
Chris.
cheap anymore, and they don't have set prices anymore, right? Because
Right.
the way healthcare has gone has gotten so expensive. I saw a graph once that the same healthcare plan that cost $1,000 a year in 2000, by 2020, that same plan cost $20,000 a year.
Right.
And so that's the challenge what we're facing with healthcare, and
Yeah,
long-term care is a big part of it.
it is. And there are so many factors that come into play. I mean, my father's in danger of losing the family farm he inherited because my
Oh,
mom is in long-term care. And family farms and family businesses, or people who own businesses, they have to sell their business rather than pass it along just to pay for long-term care,
right.
because if they inherit it, like my dad had no money, and my mom and dad didn't have much money, so the state and Medicaid kicked in, and they're
Yes.
paying for her long-term care, right?
Right.
Well, then my grandfather passed and my dad inherited the farm. Then the state, we have to figure out how to keep the state from coming after that to pay for that. The state can go back and make you pay. If you
Right.
come into money, they say, well, we want that money because we've been paying for your long-term care. And
That's right.
so
And
a lot of people,
the Medicaid collectors are good.
yeah, yeah. But that's, a lot of people are losing family farms that have been in the family forever. Like that family farm has been in my family since the 1800s. And
Yeah.
because of long-term care, it might not be able to stay in the family.
That's right.
Because after my dad dies, the state can go after it
Yeah.
to pay for my mom's. So it just depends on how much she spends or how much, how long she's in there. And
Right. Well,
it's
and you've
tough.
probably seen some of the limitations of what they will actually cover, right?
Oh yeah. Yep.
And so the long-term care plans, they don't, if you've got issues, they may say, "Oh, that's preconditioning. We're not going to do that. We're not going to help you with that. That diagnosis happened before you came here. Nope, we're not taking care of that as part of your long-term care policy." And
Yeah.
so you've got to make sure that you've got resources there for you so that you can get all those things cared for.
Yeah. And I know you can help people make sure they have the right coverage for these things. Now we're almost out of time, but before we go, let our listeners know one more time, Chris, how they can get a hold of you to get that plan in place.
So they can give us a call at 719-210-4242. You can reach out to us at our website, nolanfinancialpartners.com. But to set up that complimentary consultation, give us a call at 719-210-4242. Mention you heard us on the radio and this show, and we'll take care of you.
All right. Well, thanks, Chris. And listeners, thanks for tuning in. That does it for today's episode of Nolan Financial Radio with our host, Chris McKinney.
Join us again next time for another episode of Nolan Financial Radio.